virus attacks people in nursing homes. It is ground zero. The nursing homes are the top location where this predator feeds. Now is not the best time to put your mother in a nursing home.
Some accurate and real information today on what went on with these decision-making processes from when visitors were first stopped from going into nursing.
Why are you keeping visitors out and allowing staff to continue to go?
No, what the data we have shows the 37,000 positive staff, but that because we didn't test visitors, but the presumption is, and I would tell you, the presumption is that the visitors also brought in. I don't want to, like I said, I don't want to blame anyone. Because the nursing home staff. Because the nursing home staff are someone that we can go ask and that we want to get tested, and it's a little bit different to walk up to someone and just say, you came to visit your relative.
It seems to me, I'm directing the question about family, not about staff. Families are complaining that they are not able to supervise on a day-to-day basis, so there are no outside eyes to see what's going on. That their family members are deteriorating very significantly, that they cannot use technology because they're much older people.
I agree. I understand.
The same thing is being face-to-face. So what is the basis for excluding family
Sure.
completely? If you know not, why can't you set up a protocol for every nursing home where the family members are tested? It seems to me, as somebody previously said, that staff work in various places. They go home to their own families. They take public transit, while it's the families that are going to be the most careful because they don't want to infect their family members who are in the nursing home. What can we do to allow families in nursing homes today?
I am extremely, like I said before, empathetic to those who have relatives that they don't see and they need to see them. I get that. I really recognize that. The reason I say also visitors is because everyone lives in the community. The people who work in the nursing homes live in the community. People who visit live in the community because the person who is in that area is also in the community. We do know from our testing of antibodies that we do know that that some of the visitors in that community were positive. We do know from the zip codes with a 50% positive and some zip codes 25%.
Why can't you set up? Let me question. Why can't you set up a protocol where you actually test the visitors? Most of the visitors, from what I can understand, are staying home, socially distanced, unlike the nursing home working several jobs. I would like to see you set up a process as soon as possible to test the visitors, to give them the questionnaire, check their temperature before they come in.
Thank you so much.
117, yes, 117 nursing homes already have visitation programs that we have put into place. We have 209 that have policies that are put forth. We want to move forward. I really do want to move this forward. I want to help, but I also do not want it to spread. The reason it goes back to the visitors issues, they live in the community, they work in the community, right? And I just don't want this to spread.
My investigative team wasn't able to identify a single other state that counts nursing home deaths as we do. And regardless, and respectfully, it's my opinion that your administration's definition truly misrepresents the true scale of this crisis in our nursing home as a result. So let's try and get the full picture here and now. How many of New York's nursing home residents died in hospitals?
I know that you want that number, and I wish I could give you the number today, but I need to be sure it's absolutely accurate. A little bit as to why I'm saying that, because numbers, we ask the nursing homes information. They provide information, sometimes it's dated all the way back to December 2019, obviously before coronavirus.
The seat of the New York State Department of Health is sent hospital patients, irrespective of their COVID positive status. so that any concerns of conflict of interest may stop?
So I think I will echo what Gareth just mentioned, is this pandemic is not over yet. And New York has made an aggressive response regarding the pandemic. And you know, I think that we need to work through the pandemic.
Are correct, namely that the admission of COVID-positive patients to nursing homes had a negligible effect on the spread of the coronavirus disease there. If this is true, then what explains the impetus for the reversal of the March 25th directive in early May to prohibit nursing homes from accepting COVID-positive patients?
So this goes back to that statement I made earlier in my opening remarks about there's a false narrative out there. And this is where I have to correct these statements that are being made. There was no reversal. The March 25th memo is still in place. We still say, based on the guidance of CMS and CDC, that a nursing home cannot accept a patient without being able to care for it. That's part one. The May 10th guidance that you just referenced was about the ability to test people who are leaving the hospital. And again, as I also mentioned in my opening remarks, we have to look at this in each moment in time. In May 10th, we were able to test. On March 25th, we were not able to test, and what we were asking back at that point is to make sure that no one is discriminated against, and we still feel that way. No one should be discriminated against based on their COVID status.
Okay, so if there's no statistical correlation between the unconditional admission of COVID-positive residents to nursing homes and the rate of infection in them, then why would there have been a need to establish specialized facilities for the isolation and care of COVID-positive residents?
So let's also think about this at that moment in time. We were sitting with projections of suggesting that 140,000 people were going to be admitted to the hospital with coronavirus. We have a 53,000 beds, and that's across the state, 26,000 downstate, which is where most of these cases were initially, obviously. And we were planning for what we would need to do in case there was a surge of even more cases. We had to look at this with projecting going forward. We could sit here now, 6 months later, 4 months later, 3 months later, and be able to sort of say, well, these are the facts that we have. But as I said in the presentation, it is important to stand there at that moment in time and say, what should we be doing? Governor Cuomo, I remember the meetings, and there are many meetings saying we need to project. If there's a surge of 140,000 potential cases.
I watched Governor Cuomo's press conferences. He went on and on how he was the one that was the benchmark on how to handle and stop the pandemic. At one press conference, he was asked, why did the nursing homes have to take the COVID patients? And he answered, because that was the rule. I think about all the families who are unable to be with their loved ones as they take their final breath, and all the families whose loved ones, not sick with COVID, but are also being deprived of seeing the people who love and sustain them. To hear Governor Cuomo turn his command that this was the rule into blaming the nursing homes, their employees, and even the families for the thousands of deaths, while he went on his brother's TV show joking about COVID testing with a giant cotton swab and laughing on a late-night TV show about his stage 0 dating life, is a knife to my heart. We need accountability. Instead of protections being given to the nursing homes, and worse, to those who mandated the nursing homes take the COVID patients. Why did Governor Cuomo mandate that the nursing homes have to take the COVID patients when the CDC advised against that? I hope that as a result that we will be able to have a Bill of Rights for seniors, where families and seniors are given rights to be able to care for their loved ones pre-COVID.
Mrs. Webster mentioned some of the issues at the facility where you lost your mother. Have you heard from nursing staff or any other residents or through your loved ones about the possibility of commingling of positive COVID patients with other residents?
Let me stop you there. While I did lose my mother in a nursing home,
something that the Senator mentioned, if there was time, you can use my time. If there's a personal story that you were that affected you and your family that you'd like to share? Use my time.
My mother was, I'm sorry, I'm hearing, I don't know if someone's trying to ask a question. My mother was in a nursing home, which was only supposed to be for a very short time. From what I understand, once she became ill, like one of the other women here said, all I heard was my mother's moans and groans of the pain and discomfort she was in. Yet every single time that I called on a daily basis, I was reassured that she was okay. I kept asking what was going on, why she couldn't talk, and they were telling me she doesn't have a fever, her vitals are okay. So when all of this happened, we were blown away by the fact that we didn't know she had contracted COVID. There's a record in her chart saying she had it. No one told us, so we were completely off guard. When on the day she was supposed to go home, we found out she can't even speak on the phone. They downplayed it to the point where they asked if she was a smoker. She was having trouble breathing. The director said he had no idea why she was having trouble breathing. She waited for about 4 hours for an x-ray when they didn't even put it in as an emergency. And several hours later, when they waited for the results, she went into respiratory distress. And she was basically on a ventilator by the evening. So we were wondering why they were going to discharge her. She was well enough to go home, according to them that morning, because we were arranging for her to go home, yet she was on a ventilator by the evening. So there's something really, really wrong here on how they were trying to discharge COVID positive patients in order for them not to have died on their watch and increase their tally. So it's criminal that you discharge a sick